Hi, my name is Angelica Houston, and today I will be talking about health issues that are prevalent in transgender women. I'm sharing this for my Women in Health class, and let's talk about it. So, what's the deal? First, I'd like to share an introduction for those who are unfamiliar with this topic. For those who don't know, a transgender woman is an individual who is born a male but identifies as a female. One in every 30,000 women identify as transgender. Today, we'll discuss the health issues surrounding transgender women and compare the significance of these issues in the United States versus Canada. First, we're going to talk about the demographics of these health issues. Transgender women are at an increased risk for contracting HIV, and many transgender women do not have a primary care provider that is capable of treating the virus. Transgender women are statistically at a higher risk to commit suicide. Black transgender women specifically are at risk to experience physical violence. 16% of trans women had experienced domestic violence in the last year, compared to 7.5% of cisgender women. Trans prisoners are about 10 times more likely to be victims of sexual assault than the general prison population. Poor habits and ideations. According to Williams Institute, 81% of transgender adults in the United States have thought about suicide. 42% of transgender adults have attempted suicide, and 56% of transgender adults have engaged in non-suicidal self-injury over their lifetimes. Transgender adults are significantly more likely to experience mental health issues throughout their lifetime in comparison to their cisgender peers. Additionally, 28% of transgender individuals report consuming excessive amounts of alcohol, and 31% of transgender individuals report problematic drug use throughout their lifetime. Harmful relationships. According to the National Institute of Health, transgender individuals are 1.7 times more likely to experience any intimate partner violence. Transgender individuals are 2.2 times more likely to experience physical intimate partner violence, and 2.5 times more likely to experience sexual intimate partner violence in comparison to their cisgender peers. Transgender men and women are disproportionately affected by intimate partner violence in comparison to their cisgender peers. Intimate partner violence is more common for transgender individuals of color and those who have disabilities. HIV and AIDS. HIV, known as the human immunodeficiency virus, is a virus that prevents the body from properly fighting infections and causes the person to become extremely ill. 19.1% of transgender women globally have contracted HIV. It is possible to contract HIV and still live a relatively normal life. People will not know if you have HIV unless you tell them, typically. 19% transgender individuals report that they have been refused medical care of any kind due to their gender identity. Prevention education should be offered to all individuals, and there should be a program offered that allows any and everyone to be treated for HIV and/or AIDS. HIV continued. Human immunodeficiency virus is transmitted from one person to another through bodily fluids, which is seen primarily transmitted through sex. Semen, vaginal fluid, blood, and breast milk are all fluids that HIV could be contracted through. There is currently no known cure to treat HIV. 39.9 million people are currently living with HIV worldwide. 630,000 people died of HIV in the year of 2023. Most individuals only live for 3 years after getting an HIV diagnosis. Living with HIV can be extremely stress-inducing. There is a significant number of people who have HIV that also struggle with depression. Additionally, individuals who have HIV may struggle with getting a partner, having a partner who's comfortable having sex with them since they have HIV, and they may experience bullying of any sort because they have HIV. Signs and symptoms of HIV: swollen lymph nodes, rash, fever, fatigue, night sweats, diarrhea, weight loss, mouth ulcers, chills, and more. Everybody can present differently with HIV and AIDS, depending on what their body is currently going through and what infection it is trying to fight. How do you remain safe and protected from contracting HIV? First and foremost, ensure that you're using protection with your sexual partner. This could be condoms, this could be contraception of some sort, such as birth control, or this could be abstinence, which is the most successful form of protection. You need to ensure that you're seeing a primary care provider who is able to test you for sexually transmitted diseases such as HIV, and who would be able to treat you if you did contract HIV. If you are not using protection, or if you're having sex with multiple partners, you should be getting tested for sexually transmitted diseases and sexually transmitted infections regularly to ensure that you do not pass the disease to another sexual partner who has not already contracted HIV. And always discuss safe sex with your sexual partners so that you have a mutual understanding of what you think safe sex is, and you have an understanding of if the other person has any sexually transmitted diseases or sexually transmitted infections that you need to be cautious of. Let's use some percentages. Out of 1,608 U.S. trans women, 42.2 tested positive for HIV. Out of 1,059 Canadian trans women, only 7.5% tested positive for HIV. The rates are significantly higher for individuals who are in the United States than in Canada. According to a CDC special report on transgender women in 7 U.S. cities between 2019 and 2020, 4 in 10 transgender women, 42%, were living with HIV. Surveyed cities include Atlanta, Los Angeles, New Orleans, New York City, Philadelphia, San Francisco, and Seattle, which are all very highly populated and highly concentrated areas. Next, I will be sharing information from Asher and Lyric, and this information is to preface the next slide that I will be sharing, which discusses trans rights in different countries throughout the world. This slide is just explaining how Asher and Lyric got their statistics and what their statistics mean. So Asher and Lyric says, this new study is an accompaniment to our annual LGBTQ Travel Safety Index to specifically address transgender issues. After 100 plus hours of research, we reviewed all countries' individual laws and gathered data from a variety of trusted international sources to create the definitive Global Trans Rights Index that will help you find the safest and least safe countries in 2023. According to the Asher and Lyric Global Rights Index, the United States ranks number 40. According to the Asher and Lyric Global Rights Rights Index, Canada ranks number 3. So let's talk about how they got those numbers. Canada has worker protections for sexual and gender identity. This means that if an employee is being discriminated against because of their sexual or gender identity, the person who is doing the discrimination is eligible for a penalty of some sort. This could be getting fired. This could be suspension. It could even be illegal, like a legal ramification. Canada has constitutional protections against discrimination. So this means that it is written into the Canadian Constitution that discrimination specifically against transgender individuals is illegal. Canada has criminalization for hate crimes against trans individuals. So this means that if a hate crime is committed specifically against a trans individual, there will either be jail time, there may be a fine, there may be some other sort of service that they'll have to do for committing that crime. And then there is transgender legal identity laws in Canada, which means that transgender individuals are able to legally change their name and change their identity through the state, through the country, whatever that may be. And the trans murder rate in Canada is a mere 0.2. Overall, the Global Trans Rights Index score that Asher and Lyric calculated for Canada is 247. Now for the United States. The United States has worker protections for sexual and gender identity, which again means that if a discrimination crime of some sort is committed against someone due to their sexual or gender identity, there will be ramifications for the person who committed that. The United States has has limited protections against discrimination, which is less than Canada has. Criminalization for hate crimes against trans individuals, which is the same as Canada. Transgender legal identity laws, which again, the United States allows transgender individuals to legally change their name and change their identity. And the transgender murder rate for the United States is 1.1, which is significantly higher than Canada. The Global Trans Rights Index score for the United States, calculated by Asher and Lyric, was determined to be 168. So, what is Canada doing different? Canada introduced a bill known as Bill C-16 that specifically protects trans individuals from discrimination, hate crimes, and genocide due to their gender identity. Canada considers intentional misuse of pronouns a hate crime, and the person who is doing so is liable to go to prison or to be charged a fine for their acts. This means if I know that someone I'm speaking to identifies as she, her, and I intentionally refer to this person as he, him, or another set of pronouns, if I'm doing it maliciously and I'm doing it intentionally, there could be legal charges pressed against me by that person because of how I acted and how I spoke towards them. Canada ultimately provides federal protection for transgender individuals against discrimination of any kind. This means that transgender individuals are protected by Canada against discrimination from any other citizen. The United States does not have this federal protection. That leads us into our next topic, which is where does the United States fall short in comparison to Canada? The society in the United States is overall less welcoming, less supportive, and less inclusive of transgender men and women in comparison to Canada. With that being said, the United States is still more accepting than most other countries. It needs to be noted that the Asher and Lyric Trans Rights Index was included over 200 countries, and Canada was number 3, and the United States was number 40. So by no means are these the two worst states out of all of the countries. They're not even close to it, but there are most definitely still issues in the regulations regarding transgender rights in the United States and in Canada. The United States experiences high amounts of violence against the transgender community and has no explicit law in place that prohibits violence against transgender individuals. There are laws in place that prohibit violence as a whole, but there is nothing explicitly stated that there will be a punishment for violence against transgender individuals. Canada has this law, but the United States does not. Now we'll be talking about political, cultural, and social differences between the United States and Canada. The United States is led by a president, while Canada is led by a prime minister and has a queen. Canada is known to be more welcoming than the United States due to their lax regulations surrounding immigration. Canada's population as of 2022 was 38 million, while the United States population as of 2022 was 333 million. Canadians are known to be more apologetic and extremely friendly. Canada is less religious than the United States, with only 27% of Canadians reporting that they are religious and that religion plays a role in their everyday lives. Next, I'll be sharing demographics of these health issues. Support for transgender women in Canada versus the lack of support for transgender women in the United States is likely the reason for the significantly higher HIV rates. The government of the United States ultimately needs to pass bills that provide support for transgender women, such as the Transgender Bill of Rights, which would allow for equal and available health care for trans men and women. The Transgender Bill of Rights would also decrease discrimination and ensure equal education for trans men and women. And just to be clear, this is just ensuring that transgender men and women get equal rights in comparison to cisgender men and women. We don't want transgender individuals being denied, for example, admission to college because it's on their application that they're transgender. We don't want transgender individuals being denied from healthcare providers because it was identified that they were transgender. It's making it equal and available for everybody, equally cisgender, transgender, whatever you identify as. Ethical considerations. HIV clinics have been introduced in areas where contraction of HIV is high. Many healthcare providers have begun identifying themselves as LGBTQ inclusive and signify that they do not discriminate against gender or sexual identity. LGBTQ-friendly therapists and psychiatrists are welcoming transgender patients to come in for treatment of depression and suicidal thoughts. Transgender inclusive rehabilitation and sobriety programs are currently operating, allowing transgender men and women to seek help for excessive drinking and drug use. LGBTQ inclusive domestic violence shelters have begun opening across the nation, allowing LGBTQ individuals to be a part of their programs without judgment. Possible constraints. Individuals who have contracted HIV or AIDS may not feel safe seeking treatment, or they may feel shamed. Individuals may not know that they have HIV or AIDS and do not know that they should be seeking treatment. Some individuals may not feel comfortable coming out as transgender, or they are not included in the studies listed, so the statistics may not be completely accurate. Next, I'll be sharing a real-life example. My sister is transgender and regularly experiences discrimination because of her gender identity. My sister has legally changed both her name and her gender. She feels unsafe in public with the fear that someone may attempt to attack her or threaten her, specifically because she has had friends who've experienced violence against them who are also transgender. Public transit is a serious threat to her safety, and she often feels anxious and stressed when she has to ride public transit. She does not have a primary health care provider because she recently moved. She has attempted to schedule appointments with 3 different primary care providers who have all refused her service. She has experienced bullying, has received threats due to her gender identity, and has lost friends because they did not support her coming out as transgender. She works in a male-dominated field, which made it extremely hard for her to secure a job placement because many companies did not want a transgender female on their staff. Ultimately, there are many struggles that a transgender female has to experience in their day-to-day life, and it is unfair that they have to be anxious or stressed to simply go about their day. In summary, 1 in every 30,000 women identify as transgender. Transgender women are at an increased risk for contracting HIV, and many transgender women do not have a primary care provider that would be capable of treating the virus. Transgender women are statistically at a higher risk to commit suicide, and Black transgender women are at high risk to experience physical violence. In conclusion, Canada is significantly more supportive of transgender individuals in comparison to the United States. This is simply because of the federal bills that have been passed to prevent discrimination and hate crimes against the transgender community. The United States needs to provide easier accessibility to healthcare, federal protections for the trans community, and be more inclusive in their decisions. Overall, individuals in the trans community will likely struggle to be seen for years to come, but until then, the best thing we can do is advocate for equal rights for all, no matter sexual or gender identity. Thank you so much for listening.